This video blog, we're going to touch upon shoulder impingement, which is a very popular diagnosis that people will have. So one simple test you can do is place your hand on your opposite shoulder, keep your hand flat, raise your elbow up as high as it'll go. You don't have to lift your hand off. If that hurts anywhere in the shoulder on either side, chances are you have a shoulder impingement. So one do-it-yourself thing you could do is, in a previous video we talked about back pain and how you could use the lacrosse ball in your glutes. You could also use this lacrosse ball in some of the pec muscles that you train, especially weightlifters, or if you do a lot of push-ups or just sit at your desk a lot, you tend to get really rounded, so these areas get very tight. If you take this lacrosse ball, hard rubber ball, doesn't give much, and you put it, this is where it gets a little awkward, you put it in front of your chest. Most people are used to doing this behind their body, but here you do it in front. You'd put pressure on the areas and kind of roll this around and see where there's a tight and painful or restricted area or areas. Once you find that, it's going to make you kind of jump. Then what you would do is you would work this in a couple different directions, side to side, up and down. And then what I'll tell people is on that third step, first step is to find it, second step is to go up and down and side to side, and third is to really narrow in on the most painful spot and just gradually, that's the key word, very gradually or slowly push and allow that area to release. And then what you can do is go back and retest right away and see if that took away some of the impingement pain or just the feel of it. If it did, you know you probably have a key trigger point that will contribute to your impingement. Now if it makes no change at all, at least you're on your way to finding some key areas, and then you might want to seek some more treatment from a qualified physical therapist, or even see your doctor if there's more serious problems. So hopefully that little trick helps.